Good evening, everyone. Thank you very much for joining us for this webinar. My name's Jacob. I'm one of the co-founders of Accurate, and I just wanted to say a quick hello. I'm really excited with what we're sharing today. The pilot practices have had great success in getting their patients engaged through patient triage. And so this next step of bringing it into our inbox and letting you save into the record is something we can't wait to share with you. I'm going to hand straight over to Katie, who's going to go through some quick housekeeping about how today's going to work. And thanks again for joining. Cheers.
Thanks, Jacob. And hi, everyone. Thanks so much for joining us. This webinar will be recorded and posted on our Facebook group and our YouTube channel. There's also a Q&A function in the webinar, and we would really like you to use it. If you find that you'd like to ask a question that someone else has already asked, then please use the upvote function. That helps us to prioritize what questions to answer and make sure that Q&A box stays tidy. We'll answer questions in priority order based on sort of popularity of the questions after Hannah and Lucy have finished their presentations. And we'll also prioritize based on questions that are around patient triage and its integration with EMIS and System 1. If we run out of time and we're not able to answer all of your questions, we'll make sure that we have all the answers available in our help centre. So I'm now going to pass over to Lucy, who's going to start us off by demonstrating patient triage.
Thank you so much, Katie. I'm going to share my screen. There we go. You should all be able to see my screen now. We are really excited about patient triage, as Katie says. We launched it a few weeks ago, and we have a number of practices already using it, and a whole host of practices signed up to use it. So I'll explain what it is, what it looks like, and then I'll hand over to Hannah to explain how it's going to integrate with System 1 and EMIS in the next couple of weeks. So it's an online consultation system whereby practice can get in touch with their practice, patients can get in touch with their practice and ask admin or medical queries. So I've got a nice couple of examples of practice that are live using it. I just wanted to show you. So here's Wilmslow Health Centre, which is one of our first practices to start using it, and they've got a consult us online front and centre on the website. Here's another practice, Trumpington Street, that are using it. And I wanted to show you a slightly different way of presenting it because they've got some text here just explaining what it is to the patient, explaining that it's not for urgent requests and that it may not be read for a couple of days. So if the patient clicks on the link, it will open up a page like this, which will say the name of the practice up here. And it says at the top of the page that, again, that it's not for urgent requests, and it may take up to 2 working days for the practice to get back to the patient. This is one of the features we are currently customizing so the practice can change the time frame within which they promise to get back to the patient. The patient is reminded that if they're seriously unwell, they should call 111 or 999. And if they click on this link for more information, it opens up the NHS website about when to call 999. Sorry. Hang on 1 second. There we go. And then the patient has 3 things they can do. So they can seek self-help advice by clicking here, and that again opens up the NHS website. Or they can submit admin queries or medical queries. I'll show you admin queries first. So the patient clicks here, and the first thing they're prompted to do is so that they don't have any red flag symptoms. If they say they do have any of these red flag symptoms, they get this page which tells them the practice hasn't seen this and they should seek other medical help, and they cannot progress them to submit a request. So let's say they don't have any medical red flag symptoms. They have an option of different things they can submit for an admin query. And how we've designed this is that each of these options asks a series of different questions of the patient, and they should get enough, the practice should get enough information to be able to complete the admin request without having to then contact the patient for more information. So, for example, if it was a fit note, there's a question about whether or not it's an extension of a fit note or a new one. There's a question about what is the medical problem, when would the note be from and to, and some questions which might help the employer thinking about, say, things like phase return to work. So each of these different options in the admin queries have different sets of questions. I'll show you the medical request flow. Again, the patient has to say they don't have any red flag symptoms and answer a quick COVID screener. And the medical flow is different from the admin flows in that the patient just gets asked one set of questions which are generic and which don't change no matter what they put in. So, they'll put in whatever the medical problem is. Lifting. And they've got 300 characters here to explain what the medical problem is, which should be enough that the practice can get a very good sense of what's going on, but is not too much, and so will kind of limit the patient from submitting, say, multiple medical requests. They then get asked, how long have these symptoms been going on, and are they getting better or worse? And then 2 icy questions. So is there anything the patient's particularly worried about? They don't have to fill this in, it's optional. So no. And how would you like us to help? So let's say painkillers, and maybe a physio referral. And then a couple of practical questions. So how soon does the patient think they need a response? And they're prompted here that this isn't a guarantee, it's just to help manage manage patient expectation. And what's interesting is that less than 10% of patients put they would like a same-day response, but most practices who've been using it have found they definitely can meet the request within the same day. So that's all very promising. And then the patient, if they want to, again, it's optional, can say if there are any times they don't want to be contacted in the next couple of days. So I'll leave that blank for the moment. And that's it. That's all the patient has to do. So you'll see it's very quick. They've managed to log up. They've managed to open up the request. They haven't had to have an app or put the details into account. And they've just very quickly been able to answer a few quick questions, which will come through here. The patient then is prompted to put in their contact details. And with these 4 data points, name, date of birth, gender, and postcode, this allows the patient to be searched for in the patient demographic service, the PDS. So we can find the patient. And then their patient's prompted to put in either a landline or a mobile number. If they do a mobile number, that means that we can work out who they are with a 2-factor authentication, which I won't do for the moment because I think Hannah will probably explain this later. So there we go. So I've put in all my details, and then I get this page, which is just a summary of my request, so I can read through it and check it's fine. And you'll see this is what the request will look like coming into the clinician as well. So it's quite short and sweet to read. It's really clear what's going on. The patient then gets asked how they'd like to be contacted. So I'm going to put a text message and a phone call. And if they select any of these sort of interactive ones, so phone call, video, or face-to-face appointment, they are then prompted here to submit the name of a doctor if they've seen somebody about this before. And again, this is optional, but it does help promote continuity of care. So I've submitted my request, and then I get this message saying that the practice should review it within the next couple of days. And if I become more unwell or if anything changes, I can seek more emergent healthcare. So I'll hand over to Hannah now and let her explain how it comes into the practice.
Thank you, Lucy. I am going to go through the same medical flow that Lucy just demoed, and then we will see its integration into the Accurx inbox. For those of you who've used the Accurx inbox before for Florey questionnaires or the allow patient to respond ones, the responses come back in a very similar way and can be saved directly to the record, so either EMIS or System 1. Today I'll be demoing on EMIS, but it will work in the same way to System 1 in terms of how the integration comes into the inbox and how it can be saved. So here's the form that the patient has come to from the practice website. So they click a medical request. They do not have any of the red flag symptoms. No household members with COVID symptoms or COVID symptoms for themselves. And then I'll do a similar request. I'll say back pain at the bottom. My back started suddenly. So a short and sweet sentence under 300 characters. Then I'll say how long have these symptoms been going on? About 2 weeks, not getting any better. So anything particularly worried about? Damage to my back. Do I need a scan? So help is painkillers, maybe a scan, physio. So the patient can list some things that they might be interested in. Expecting response, they can say, yeah, with it today, tomorrow, or within 3 days. And then there are none. So now this is really important for the inbox integration for AccuRx in terms of how we can ensure that the patient who's submitting a form is the correct patient and that we can save that to the correct medical record. So what is happening here is the demographic details that the patient puts in are matched against the patient demographic service, also often known as the spine, and that will then look for an exact matched patient and try to ensure that we have a unique verified match in our system. If we are not able to find a unique match in the system, we will have a system that allows practices to manually match that patient, similar to the way that you would match a patient if someone calls up over the phone and provides their demographic details. But in the ideal world, if the patient demographic details match exactly, then we can do that matching without an additional step. So we have this two-factor authentication step. So this is looking for the mobile number that I have in my hand compared to the mobile number that's on the record of this patient. It happens to be the same mobile number, so it's going to send me a code. So this is similar to two-factor authentications that you might have on banking or other types of apps that would just basically verify that the phone number that has been registered as part of that unique demographic is also the one that you have access to. So that's just a second step to affirm identity. So I've put in that code. I can now see the summary. I say if I want a text message or a phone call, and I'm going to ask for a confirmation text. So I'm going to submit that request. And in a moment or so, we should see that request come through. There it is. So it's now come through to the AccuRx toolbar. If we click on this message, it will come to a folder called To Assign. How this folder is generated is when we turn on the patient triage system, that the non-clinical members of your staff will get added to a To Assign folder. They can mute the To Assign folder if it's not appropriate for their role, but if it's appropriate, they would then be notified of any new incoming messages, especially in the mornings when there are maybe requests from the evening, and then they can go through it and review those. So here we have that medical request. We can see the details of that request that was submitted. We can click Save to Record. That will save to the medical record in the same way that a Florey questionnaire response or a single patient response saved. I'll give that a moment to load. While it's saving, we can also open this unique patient in our medical record by clicking on the 3 dots and then clicking Open in EMIS Web. So here we have EMIS having updated behind us, and we can click Consultations, and in a moment or so, we should see, yep, this has saved to record, and here is that e-consultation. So we have a SNOMED code e-consultation via online application, and then some free text talking about what kind of request it is. Then we have all of the information that the patient has submitted. If you go back to the inbox, this message can also be specifically assigned to an individual or a team. So we have here, we've got doctor's team, nursing team, prescribing. So I'm going to assign this one to the doctor's team. So that now has been dealt with from the To Assign state. If you look at the doctor's team, they have now received this. Anyone who's in the doctor's team would be notified of this message, and they can either click message, and that means that they would send a follow-up SMS to the patient, or they can click done, which means that they've seen the patient or spoken to the patient, and that query has been taken care of. So you can find that in the done folder, and there you see that it was assigned to the doctors, and then it was also marked as done. If you reopen that message, it would go back into the doctor's team, and you could see that again in the doctor's team. So with this integration, currently we are able to match the demographics when the patient puts in their personal details exactly as according to what we have on the spine. If there was a typo with, say, the date of birth or the postcode or their name, we wouldn't be able to provide this exact match, and we couldn't just click Save to Record. We would need to have a more manual matching flow. What that basically would look like is similar to the search for patients. So if I saw that the patient had written like that, Mickey, I might say, oh, it's very likely that the patient's name is Mickey that way. And then I can search for the patient, and I would be able to click on one of the patients from my medical record, and it would let me have an exact match. That integration part is still in process. So the only thing that we have at the moment is this exact match state. What we're hoping to have is by beginning of September to have the full range of different types of matching states available in the inbox to be able to come in and easily save to the record. And that's it for me.
Thank you very much, Hannah and Lucy. We will move on to the questions now. Cool. So the first question, I think, is for Lucy on patient triage. We've got some questions around the difference between patient triage and e-consult.
Sure. I think there are quite a few other different products and providers out there, and they all offer different things. The main thing that AccuRx patient triage offers is, firstly, it's very, very simple. So it's very, very simple for the patient to use. As I showed, the patient doesn't need any login, they don't need an account, they don't need to download an app, excuse me. But also, once they submit the questions, it's very, very quick and easy. It's only 6 quick questions for them to write. So that's one of the main ways in which we differ from other people. Also, that simplicity carries into the practice's workload. So it's very quick for the clinicians or the admin staff or the reception staff to see what the request is about and quickly triage it. And finally, we are going to be integrating with System 1 and EMIS shortly, which is something that will make it very quick and easy to use, because you'll be able to save the request to record in one quick click rather than sort of copying and pasting and so on.
Great, thanks, Lucy. So one of the next questions is on the inbox. Hannah, who sets or assigns staff into the teams in the inbox?
Yeah, no, it's a great question. So our default setting is that when the 2 assigned folders generated, we put everyone who has a non-clinical, either EMIS or System 1 role into that team. And then there's a little prompt that says why they've been added to the team and that they can mute the team if it's not appropriate for their role. For the other teams that I mentioned, doctors, nursing, prescribing, reception, admin, and secretaries, those are all generated also based on either EMIS or System 1 roles. So we read all of the roles that we have on each AccuRx user from our record and put them into the appropriate team. This is a feature that we have currently been testing with a handful of practices. It seems that our automated process gets it about 80 to 90% right. We know that we want to be able to allow practices to edit that. So through the Manage Practice page, we'll likely create some type of spreadsheet where you'd be able to add and remove users from teams as appropriate. But that's how they're added for now.
Great, thanks, Hannah. And can you assign to individual doctors rather than a team?
Yes, absolutely. So the current assignment function works just like that. You can currently assign any individual message or conversation to one user at your practice. This is definitely useful for assigning to a specific duty doctor, for example, to be able to have that named person, and that will show up in that scrolled list that I demoed a moment ago.
Great. And Lucy, on patient triage, can the different options for the types of appointments be modified?
So yeah, that's a really good question. So at the moment, what I've shown you is as it is. There's not much customization, but it's something we're looking into, and this is quite a new product, so we're really keen to understand how to improve it and what to focus on next. So at the moment, no, but watch this space, and if anyone has any suggestions, then let us know, because we'd love to hear.
Great. And another question on patient triage. Does the patient have to submit their contact details each time they submit their request, or are they registered for the system the first time they submit their request?
Yeah, good question. So they do have to submit their contact details each time. Because we've chosen to make it very easy to access, that also means they're not creating an account or having to remember a password and so on. So they will have to submit their contact details each time, but hopefully you can see it wasn't too much faff to do so. And in fact, we actually had a practice tell us that a 98-year-old gentleman submitted a request without any help from anyone a couple of weeks ago. So hopefully that's sort of living proof that it is very, very quick and easy to do.
Great, thank you, Lucy. A question that you both might be able to answer is, what do we do if the patient isn't registered with our practice?
I think I can try to answer that. Yeah. So currently, if a message would come in for a patient that is not registered at your practice, they do provide their contact details, and we would display those contact details in that summary that you would see. So you would have the option to call them. We are looking at alternatives on how you could contact that patient either via SMS or other ways, so that you wouldn't have to call each one. But that's what we're looking at from the inbox side. I don't know if Lucy, you have anything else to add?
No, yeah, that's correct. Yeah.
Great, thanks, guys. Another question is, lots of our patients change their phone numbers frequently or access us with someone else's phone when they're out of credit. So will this create additional work for admin having to verify their details?
So what our current thinking is that we would allow that message to still come in and match to the patient if their demographic details were matching the spine as in the system. We would just add a note that the two-factor authentication was not successful, so that if you had any reason to believe that potentially that patient is not who they say they are, that you could contact them or follow up on them. But otherwise, if you had every reason to believe that is the correct patient, you would be able to click save to record in the same way that I just demoed.
Great, thanks, Hannah. So another one on patient triage. We are a student practice, so get requests for medical notes, which are not Med3 notes. Can we customize the admin section for fit notes and link it to another part of our website? Lucy, that one might be for you.
Oh, that's a good question. Again, at the moment, no, it's as it is. But if there was, I imagine at the moment that would go into the anything else admin request that a patient can submit. We'd love to hear what the difference between the current Med3 note and what you'd want is, because then we can look at changing this if needed.
Great. A question for Hannah. Does this mean that practices will be able to customize teams or filters for different groups to assign incoming requests to? What about staff who are on leave? Is there a function for an out-of-office facility?
Yeah, really great questions. So currently what we're looking at is only to have those default teams, which are, as I said, doctors, nurses, prescribing, reception, secretaries, admin. We recognize that this does not capture all of the teams that work within a practice, but this is our first step towards that. It may be in the future that we look to allow practices to create custom teams, but currently those are the default teams that we would be able to support. In terms of the out of office question, we don't have anything that allows for an out of office or redirect. Everything within the Accurx inbox is viewable to anybody within the practice. So if you're specifically concerned around patient responses or patient triage, there are folders on the all folder to help you track those and to look into if there are any outstanding messages that haven't been dealt with. And this is potentially a monitoring role within the practice. In the future, we will look to build some functionality to let you search the inbox by a specific colleague. So if you know that Dr. Brown is on annual leave, that you'd be able to monitor Dr. Brown's My Inbox, but we currently aren't able to support that functionality just yet.
Thanks, Hannah.
Can I just add to that, Katie,
of course,
if that's
yeah.
all right? Yeah, just to say that, so there is a line of text that does prompt the patient to understand that might not be possible to see the doctor they've requested, and just that it is generally better if you can see the same person about the same thing, but that might involve a delay. So that hopefully manages the patient's expectations. And then it's very much, as Hannah said, it's transparent at the practice end to see what requests have come in. So it will then be up to the practice to say, oh, actually, this is Mrs. Jones and she's coming with her chronic pain.
I think there's a little bit of sound problems, Lucy, sorry. We'll move on to maybe another question while Lucy checks her sound. So I'll just have we look at a question for Hannah then.
I can answer the one about match rate through PDS in the beta practices.
Thank you, Hannah.
Yep, so currently we are seeing at about 50%. We had one of our beta practices do a really interesting study on what constitutes an exact match on PDS. And this might be something that we look to increase in terms of like fuzzy matching to see if a patient has potentially like missed the space in their postcode or some other details like that we could just ensure to check that to try to improve the match rate. But currently what we're seeing, is about 50%. There are some things that we've been reading and researching about that potentially could increase the match rate in terms of how the patient submits the form and how the phrasing is put on the website. But we haven't yet implemented those, but we obviously will continue to monitor the match rate that we are able to achieve, and we'll look to increase that as much as we can.
Great, thanks, Hannah. There's some more kind of on assignment here. So if a doctor receives a query, for example, back pain, and the message needs then forwarded back to admin so that they can sort of an appointment out, is that possible?
Muted. Muted. Yep, so that's absolutely possible. So whoever is managing the to assign folder would be able to assign it to the doctors. A doctor could look at that message, decide that they want to have a telephone consultation or video consultation with that patient, and then assign it to the admin or reception team in order to schedule an appointment. So they would just use the assignment function at the bottom there in the same way.
Great. The question is how close are you to integrating with EMIS? So yeah, I think Hannah, you maybe mentioned this earlier, but you could just confirm.
Yep, so we're hoping to be about a week out until we'll be able to get the full integration of the unmatched patients into the AccurX inbox. We'll test that with our beta practices to make sure that that all works smoothly and as expected. And then as soon as we have a green light there, we will be looking to bring that forward. So we're saying early September.
Great, thanks for clarifying that. And is there a way to see how many consults each clinician has dealt with?
It's a great question. Currently, we don't have a system like that in the AccurX inbox. I know that there is something similar in EMIS when you're assigning either prescriptions or referrals. It could be something that we look at building in the future if that's really valuable, but not currently.
Thanks, Hannah. How's Lucy's sound? Have we got any progress on it?
I think it should be working fine now, thanks.
Amazing, great, thanks, Lucy. Cool, well, we'll have some question for patient triage then. Is there anything to stop patients or spammers sending multiple or malicious requests?
No, that's a very good question. So we've taken the decision to make it very easy for a patient to submit a request, but the kind of flip side of that coin is it does potentially open it to spammers or to malicious people. So far that hasn't happened at all, which is reassuring. But if this becomes a problem, there are definitely things that we can do about it. So yeah.
Great, thanks, Lucy. And can the service be turned off for weekends or when a practice is at capacity?
Very good question. So the current way in which we get assurance with the NHS suggests that we shouldn't be able to turn the form off, that it should be live 24/7. And certainly in terms of the patient's own experience of using it, we want it really to be available to them, you know, last thing on a Saturday night if they're finishing their night shift or whatever, when it's convenient. That said, we are aware that the guidelines from the NHS may be changing, and I know that some other providers are currently allowing the forms to be turned on or off. So we're looking into that literally this week, right at the moment. And we're also looking at changing some of our out of hours messaging so that when it is out of hours, that's flagged up to the patient and they can be directed to, say, Livy or 111 or urgent treatment centres near them instead. And that will hopefully help deal with worries about demand and capacity.
Thanks, Lucy. Someone has asked that, yeah, they said it looks amazing, and how do they get access and start using it? Lucy, I think that one's for patient triage.
Yeah, that's fine. So there is a link that you can sign up for to go onto our wait list. We can share that either during this webinar or we can send it out to all invitees. So you sign up and then we'll get in touch with you and let you know how to switch it on. And in terms of switching on, it's a very quick process.
Thanks, Lucy. And what about the anticipated cost?
Good question. Let me just make sure I've got this right. So the cost is 25 pence per member of the population, so per patient, when it's purchased on its own, or it's 20 pence when it's purchased as Accurex Plus. Accurex Plus is going to be a paid tier in the Accurex chain that we'll be announcing in September, so there'll be more information on that really shortly. And it's important to know that these prices are based on if a CCG were purchasing on behalf of the practice.
Thanks, Lucy. Another question we've got is, we're currently using eConsult. The CCG are looking to move possibly to Accurex. eConsult can divert away to pharmacists for certain conditions, so GP doesn't see them. Is this something that we are looking into?
Yeah, it's something we're looking into. I don't know how imminently it might be a change that we would make, but we're certainly looking into directing to local services at the moment, and that's something we're going to be looking into in more detail in the next month.
Thanks, Lucy. Another question, someone said, it's excellent how the patient's query integrates into the notes. Can you latch on the clinician's assessment or management onto this?
Yeah, it's a great question. It is something that we are definitely thinking about in terms of other things that come into the AccurX inbox, like a patient sending in some photos or a Florey questionnaire. Not something that we currently can support, but something that we are looking into, and just in terms of how we save into the medical record and how to make that more useful and not causing as much clutter.
Thanks, Hannah. And for Lucy, what is the age limit for the patient to complete themselves? For example, can a 17-year-old complete it?
Yeah, I mean, anyone who can use a computer can complete it. There's nothing to stop them. Legally, online consultations don't differ from face-to-face consultations, from telephone consultations, etc. So the same kind of pediatric, non-pediatric cutoff would apply, and sort of sensible rules around Gillick competence.
Thanks, Lucy. Any restrictions on parent logging an issue for a child of 16 years?
Yeah, so something we're focusing on in the next couple of weeks is the ability to do a proxy request, a request on behalf of somebody else. So watch this space for pediatric requests.
Thanks. And reporting, is there any reporting available?
Oh, yes, there is. So at the moment, we allow practices to see how many submissions of what type they've had and when. And we can look in the future into sort of more granular or other reporting if it's wanted by practices. It would be great to know if there were other things apart from what type of requests and when you would want to hear about.
Thanks, Lucy. Hannah, there's a question here about Florey. Are you planning any condition-specific questionnaires, for example, PHQ-9 for depression?
Yes, so we are looking at building out additional Florey questionnaires. We know we get lots of requests, and there are lots of use cases for helping especially manage chronic diseases and cough-related conditions. So definitely something that we are looking at. But I would say that it is something that we're looking at potentially being part of a premium tier of AccurX. So we will have announcements about that, I believe, in the next months or so. Weeks, months, I'm not sure. Sorry.
Thanks, Hannah. A question here about, is there an option to reject a request if it's not appropriate? For example, a dental problem or something that can be dealt with at a pharmacy? So
we don't have currently any reject system in the inbox. You can always reply to a request and state simply that unfortunately your request has been received, but you need to contact a dentist or other provider about the request. In the future, we might look at nuancing this if it becomes a need, but for the time being, it's just the basic functionality of being able to receive the request and reply directly to the patient.
Thanks, Hannah. Could questions such as smoking and advice be added to patient triage to capture cough-related info?
That's a good question. It's certainly something that we could do. I think we'd have to think very, very carefully about adding any extra questions, because one of the benefits of this is it's very easy for patients to fill in. And we've had feedback that they don't love getting questions that aren't relevant to the thing they've contacted the practice for. So it's definitely something we could do, but I think we'd want to think quite carefully about any disbenefits to the patient and how off-putting it might make patient triage to them.
Thanks, Lucy. We've got a question around how long the service is free for.
For 6 months. You're welcome to try it for 6 months for free with absolutely no obligation.
Great, thanks for clarifying that. And Hannah, we've got a question that asks if an incoming query gets dealt with by one member of the team, does it then disappear for all other members of that team? Thanks.
Yep, that's a great question. So in the demo where I showed the to assign team, so you saw the little notification popped up. I then went in and looked at that message. If I did not mark the message as done or assign it to another team, everyone else who's also in the to assign team would also have a notification on their AccuRx toolbar that message is outstanding and has not been dealt with, either has not been marked as done or has not been assigned to another team. If a message has been dealt with by one person and is marked as done, anyone would be able to find it in that done folder, but it would no longer be considered an open conversation because clicking done is making the assumption that the tasks related to that have been completed.
Thanks, Hannah. And someone's asked, how long do messages stay in the done folder?
Yep, so messages stay in the done folder indefinitely. It's an ever-growing list of conversations. We know that this is something that in the future we will want to help support, making it a bit easier to find messages that are already done. So either with filters, sorting or searching. Currently it's just one done folder, but we will look at improving that as we go along.
Thanks, Hannah. Do you have any feedback from practices who are already using patient triage on how it's helped their workload?
Yes, we do. Different practices are using it in different ways, which is very interesting. The main feedback that we've had is that it's generally reduced a lot of the workload, and many practices have found that the number of calls that have come in has been lessened. So one practice has stated that they now have 70% of their incoming demand through patient triage, and that's easier to manage. I think they might be towards the top end of that scale. So I think other practices are not finding necessarily quite such a high number. But in general, we've had very, very positive feedback from all our piloting practices about workload. We're looking to provide more information and more details shortly.
Thanks, Lucy. Would we consider a new registration tab on patient triage?
If this is about letting patients register as a new patient, that's something we've been looking into. Yes, again, I'm not sure what the time frame on that might be, but it's definitely something that's come up as a need. So yes, we're looking into that.
Great, thanks. If a patient sends in a query with a different phone number to the spine, does the reply go to the spine phone number or the one that they used?
Hannah?
Is this the I'm going, so there's two potential replies. So when they complete the form and they put in that they have their phone number, you can choose to get an SMS confirmation. So that will, I believe, go to the phone number that was provided, even if it does not match the spine. In terms of the AccuRx inbox, if you click message at the bottom of that conversation, it would then have whatever phone number was in the medical record. So if that phone number doesn't match, you would have the option to edit. So we do display the phone number in those cases within part of the message, and the healthcare provider could choose to edit the phone number, but we would pull through whatever is in either EMIS or System 1, and you would need to update that phone number in the medical record before AccuRx would pull through a different phone number.
Thanks, Hannah. Lucy, is patient triage going to integrate with the NHS app?
Yes, it is. We've started the process on that already. I'm not sure of the time frame, but definitely that's our plan. Yeah.
Great, thanks for confirming that. Just going to look for a few more questions. Are there any plans to use AI in rating the urgency of triage requests?
Sorry, was that AI?
Yeah.
Not at the moment. Automated triage can often not be great. it often tends to over triage patients to more sort of emergency healthcare settings. So I don't think it's something we're planning on anytime soon, and I think we'd have to have quite a serious think about it, because at the moment the feeling is that if we just do something that's very quick for the patient to submit and then very, very quick for the clinician or the administrative person to review, that's a lot better than any automated system that's out there.
From the inbox side, however, we are looking to add in a flag that lets you mark a message as urgent. So if, say, a receptionist viewed that message in the to assign folder, saved it to record, and then marked it as urgent before assigning it to the doctor's team, the doctors would get that at the top of their list. So they would see that message as urgent, but that would obviously be a manual process for the healthcare provider reviewing those messages to make a decision on, rather than us being able to do something clever and try to decide which requests are the most urgent.
Thanks, Hannah and Lucy, great. We've got a question that says, I can see it can be accessed via the practice website. Is there a link for patients to be able to access it sort of separately to that? Lucy, I think that one's, yeah.
You can send, so there is no kind of like freestanding patient portal, if you see what I mean. The way to get the link is to go onto the website. That said, the web page that opens up is completely separate from the website. So if this is, I'm sort of slightly preempting the question here, but if this is about a way of sending the patient that link in an SMS, that's definitely something the practice can do. They can just send the link that opens up in a new web page to the patient by SMS and say, submit a request via this link, which is what some practices have been doing and has been working well.
Thanks, Lucy. Another question, is there a chance that information provided by patients can be coded automatically to System 1 or EMIS, for example, blood pressure or weight?
Yeah, it's a great question. It could be something that we do in the future. Right now, the text boxes that we provide to the patient are relatively generic, so we don't have any specific enter your blood pressure here or enter whatever specific information, which is how the Florey questionnaires are asking questions and how we're able to match that to a specific clinical code and encode that information to the medical record. It could be in the future if we build more or other flows that we want to add more specific clinical codes, but right now the only code that we would add is the e-consult filled by patient from online application or I believe something like that. So we do add that clinical code, which will help you search your medical record to see how many consultations have come in, but we do not add any clinical codes on what the patient has submitted.
Thanks, Hannah. Can this link turn advice requests into appointments on System 1 or EMIS for clinicians to work through?
It's a great question. From our beta practices, that's what's been happening manually. So a request comes in and reception reviews it and decides to either book an appointment. Currently, we don't have an automated way of doing that, but I know that appointment bookings is something that we have been looking into and could be something that we are able to support in the future.
Thanks, Hannah. Following on from the question about spammers, can you switch off access for repeat offenders?
Oh, that's a very good question. I honestly don't know. I'd have to look into that. So there would definitely be things to think about in terms of, are you stopping a repeat offender who has a genuine medical problem this time getting in touch? So it's something we can definitely look into, but I don't have an answer now.
Thanks, Lucy. And feel free to always get in contact with us on support@accurx.com as our email address, or chat to us, and we can also get back to you on all these things as soon as we have answers. Another question is, how easy is it to change your response times on patient triage?
That's very easy. So you just go into the Manage My Practice section of the AccuRx toolbar, and it's the second option down under Settings.
Great, thanks, Lucy. A question on the trial period. Do we have to trial it for a whole 6 months, or can we pull out after a month if we wanted to?
You can absolutely do as you please. So you can put out at any point. Yeah, there's no obligation whatsoever.
Thanks, Lucy. Another question, is there any time limit in order for patients to respond if we ask a question via text in order to close the query before the link expires?
Sorry, Katie, my internet cut out. Can you just repeat that?
Yes, so the question is there a time limit for the patient to respond if we ask a question via text in order to close the query before the link expires?
So the single patient responses and the Flurry questionnaires currently all time out after 7 days. This is just to be put in place so that we don't have links floating around for months and months, and then patients able to use them later on to submit requests that are not actually to do with the question that was asked of the clinician. So currently it's a 7-day limit, but patient triage requests, which we've shown now, and where the patient would be able to submit to the practice wouldn't have that type of restriction. So they could, a patient could initiate a new conversation that could then be dealt with as a new situation for the practice.
Thanks, Hannah. Another question is, are nursing or care homes able to send questions about different patients?
So they would be able to fill out the patient demographic details in the form on behalf of the patient. In the future, maybe Lucy would be able to answer this better, we would look at potentially having a proxy flow. So this would also be relevant for, say, a parent on behalf of their child. We don't currently have the ability to support that, but it could be something in the future. Lucy might have more details.
Yeah, it's right up on that. Given that most patients who'll be contacting practice most frequently will be pediatrics or elderly who may have carers who might need other people to do things on their behalf, a proxy flow is one of our priorities for the next month. So yeah, it's absolutely up there on our agenda.
Thanks. Hannah, when assigning messages to another team, can I add a message like needs a telephone appointment or blood test booking?
Yep, so we do have a functionality that we are still working on fine-tuning that would allow you to add a comment to an assignment. If you're really interested in testing this out, you can email me, Hannah at AccuRx, so HANNE at accurx.com. As I said, we are still working out the kinks with it to make it really good. So just be warned that it's not a finalized and polished system yet, but we are looking to be able to support that. And we know that that's definitely really useful so that we don't have messages being assigned to people who don't necessarily have a little bit of context on what they need to do with those. So definitely something that we will be looking at improving.
Thanks, Hannah. And just to clarify around kind of the proxy stuff we were talking about, we've got a question that says, so does that mean at the moment a parent can't submit a request for their child?
So anyone can submit a request, and there's nothing to stop a parent submitting a request on behalf of their child. But you would want to put, where it's the contact details, you'd want to put the child's name and date of birth, and then you could put whatever the relevant contactable phone number would be, because then our system would be able to find that child on the PDS service and match the request to that child, that child's record. So it's still completely doable. The kind of proxy flow that we're working on, the main difference will be a nicer way of just flagging up, I am submitting this on behalf of somebody else, and making it slightly clearer that that's the case when it comes through into the practice.
Thanks, Lucy. And how are practices, Lucy, currently using this method and promoting its promoting it to their patients, other than putting it just on their website?
Oh, great question. So the practices that are sort of launched with a bang and reported great patient interactions are the ones who've promoted it quite heavily. So they've done things like send out a batch message to alert all their patients of its existence. If they're big social media fans, they've put it on their Facebook, they've put it on their Instagram in some cases. They've emailed patients if they are a practice that emails patients. So in all sorts of different ways, but it tends to, they promote it with the PPG, but it tends to be whatever the practice usually finds their way of contacting their patients is. They've done a lot of that.
Thanks, Lucy. And another one on patient triage: could admin fill this in for a patient who rings in with a query and can't do it themselves?
Absolutely, and that's definitely behaviour we would encourage, because we think it's better if all requests can come through the same sort of funnel into the practice. It definitely makes the workflow easier, and understanding what the demand and what the capacity is to meet that demand is. And one of the benefits of patient triage is, as you've seen, it is very, very quick to fill in. You could literally fill in a request on behalf of somebody else in sort of a minute and a half. So where appropriate and where admin staff are happy to, we'd very much encourage that they do fill it in on behalf of somebody else who, say, doesn't have a smartphone or an internet connection, or who doesn't really feel able to. Yes, please do that.
Thanks, Lucy. And we might have time for just one or two more questions. So there's a question here around if you amend the phone number as they're using someone else's phone, does that allow the spine number to stay the correct one?
Yeah. Oh, sorry.
You can answer it, Lucy.
Yeah, so the only way of editing this or updating the spine is if the practice manually updates the patient's number in their records. So the patient can put in any contact number they want if they're using someone else's phone or if they're borrowing a phone. So if they put in a number that is the same as is their number on the patient on the patient's record on the spine, then that will flag them up as an authenticated match patient, but any other contact details can come through to the practice.
Thanks. And can a patient send in photos with their patient request through patient triage?
Not at the moment, but it's one of our things that we're looking to in the next 4 to 5 weeks. I think it's something we will be doing. We just want to make sure that it's done safely. Obviously, introducing the possibility of sending unsolicited photos does introduce clinical risk. So we're really keen to make sure it's done in a very, very safe way.
Thanks, Lucy. And I think we're almost at time now. So I'm going to stop the questions there for the evening. And I'll just share some links with you before we finish. And I know we've had some requests for the wait list, where to sign up, and you can actually go onto our website, www.accurex.com, and the wait list is right there. There's a link which says sign up to the wait list, so you can do that, or you can chat to us, and we'll give you the link. So yeah, just to cover again that the webinar is recorded and we'll post it on the YouTube channel. We've also got lots of training videos and demos and previous webinar recordings on there, so do take a look. If there's any questions that we still need answered, then please do just come to our help centre. We have lots of articles on there with answers to frequently asked questions and step-by-step guides with screenshots. And then there's the chat bubble in the bottom right corner where you can chat to one of us. And we usually respond in about 5 minutes. The last link there is our Facebook group link, which is a great place to get sneak peeks of what we're working on at Accurex, and you can give your feedback and make suggestions and chat to others that are using Accurex. So thank you very much again for joining us, everyone, and hope you have a lovely evening.